Next question deals with what is aromatization and how do you treat it? Basically, in the body, there are certain enzymatic reactions that take one substance and make another substance. Here's the example. The precursor for estrogen is testosterone. You can take and drive testosterone to estrogen. In some patients, normally like females, they produce a lot of estrogen. Men usually don't. So if that aromatization takes place with an enzyme called aromatase, then you make more estrogen. That's more problematic for males than it is for females. It would also be more problematic for a female who has breast cancer, or maybe something like factor Leiden 5, or lupus, or multiple sclerosis, or a prior history of having a DVT, like a blood clot in her leg, or a blood clot in her lung. So it's treatable by using what's known as an aromatase inhibitor. That means you're trying to keep that reaction from happening. Okay, so you're trying to block that reaction. Some of these drugs you may have heard of. The very first drug was called tamoxifen. Trade name for that is called Navadex. They have two second generation ones now. One is called anastrozole or Aromadex. If you use that, it will preclude you from taking your testosterone and making estrogen. Aromatase enzyme is also in the scalp. And the aromatase inhibitor that you guys are most familiar with, we call Rogaine, which is minoxidil. The other one is called Propecia. All aromatase means is that you're making a reaction and driving it to something else. That usually only happens with reactions in tissue. So my statement for this may be a little bit down a rabbit trail, but it deals with prostate cancer. Normal prostate cells do not produce aromatase. All prostate cancer cells do. Same thing in breast. Normal breast cells do not produce aromatase. All carcinomas of the breast produce aromatase. That's the reason why when those patients get those entities, they always get put on tamoxifen or Aromadex.